At 3 in the morning, in Almaty, Kazakhstan, a middle-aged man jolts awake from his sleep. His chest feels crushed beneath a boulder, every breath a struggle. His first instinct is to get to a hospital, but the local clinic has no cardiologist. The nearest specialist center, 300 kilometers away in the capital. 300 kilometers. When your chest is screaming in pain, that distance can be the gap between life and death. But this time, he doesn't grit his teeth and wait for dawn. He reaches for his phone, opens an app, and types his symptoms in Russian. 15 minutes later, a cardiologist from a top-tier hospital in Xinjiang, China, appears on his screen. AI translation dissolves the language barrier. The video consultation completes the preliminary diagnosis. The doctor's instruction is clear. Get an ECG at the nearest facility. Upload the results to me immediately. This isn't science fiction. This is 2026, and it's happening right now. Welcome to today's episode. Along the Belt and Road, dozens of countries, billions of people. Yet medical resources are staggeringly uneven. In much of Central Asia, Southeast Asia, and Africa, the best doctors and equipment are hoarded in the capitals. Patients in remote regions must travel grueling distances, sometimes crossing borders entirely just to see a specialist. A patient from Myanmar once marveled, "In China, hospitals perform fracture surgery at midnight. In our country, that's simply unimaginable." Harder still, the language barrier. The region spans Russian, Arabic, and dozens of Southeast Asian languages. Foreign patients arriving in China for treatment find themselves unable to read registration forms, articulate their symptoms, or decipher prescription labels. Even in first-tier cities, language remains the single biggest bottleneck in cross-border healthcare. Then, there are chronic diseases. Hypertension and diabetes run rampant across these nations, yet continuous follow-up care is virtually non-existent. For many patients, one visit is all they get. No follow-up, no continuity. The condition quietly worsens, snowballing into something far more severe. This isn't a reflection on local doctors. On the contrary, they fight with everything they have within the same constraints. The problem is stark. Resources are finite, demand is infinite. When patients cannot reach doctors, and doctors cannot reach patients, what is missing between them? What is missing is a bridge. In 2026, at the Shanghai International Medical Devices Exhibition, two companies made a pivotal decision. AISO, a global leader in AI-powered healthcare, joined forces with Umai Medical, a platform dedicated to internet hospitals and cross-border medicine, to officially launch a multilingual cross-border internet hospital. What does that mean? Simply put, they are deploying a cloud Chinese doctor team for Belt and Road nations. Technologically, it supports Chinese, English, Russian, Arabic, and Southeast Asian languages, with one-click interface switching. Intelligent voice translation covers the full spectrum from registration and consultation to billing inquiries and drug instructions. AI-assisted diagnosis performs preliminary symptom screening and triage, allowing physicians to focus their expertise on truly complex cases. In terms of service, this is no mere online chat. It is a complete closed-loop ecosystem. Real-time consultations, diagnostic recommendations, electronic prescription transfers, drug delivery, and follow-up management. Patients wear intelligent rehabilitation devices that stream real-time data back to China, where physicians can remotely adjust training protocols. One screen, one system. 300 kilometers collapse into 15 minutes. Let me tell you a true story. In Jakarta, Indonesia, a diabetic patient has been battling uncontrollable blood sugar. His local doctor can only offer vague advice. Eat less sugar. Exercise more. But how much less? Which medication? And when? No one can break it down. Through the cross-border internet hospital, he connects with an endocrinologist in China. The doctor conducts a detailed inquiry into his dietary habits and medication history, pinpointing the issue. Drug incompatibility. The regimen is adjusted. His blood sugar stabilizes. A month later, he uploads his glucose monitoring data. The doctor fine-tunes his insulin dosage based on the trend and pushes an Indonesian language dietary guide to his device. On the third consultation, he reports numbness in his feet. Through video examination, the doctor identifies early-stage diabetic foot and immediately advises him to seek care locally, providing a specific checklist of required tests. 3 consultations, from treating the disease to managing life, from emergency response to preventing deterioration. The patient later posted online, "It used to take a month to see a doctor. Now I can ask anything, anytime. Chinese doctors don't just treat my illness, they teach me how to manage my life." You see, this internet hospital isn't replacing local doctors. It is adding a layer of protection. When local resources fall short, a team of Chinese doctors stands watch in the cloud. Now, let's talk about the doctors on this side of the screen. You may have heard of Professor Xu Chang, Director of Vascular Surgery at Fuwai Hospital, Chinese Academy of Medical Sciences. For over 2 decades, he has demonstrated 201 aortic surgeries across 21 countries and regions. He was appointed as the first Chinese adjunct professor at the University of Indonesia and serves as a visiting professor at 11 world-renowned institutions, including Stanford, Yale, and Harvard. In 2024, Fue Hospital established the International Aortic Minimally Invasive Training Base, signing memoranda with cardiovascular centers in Belt and Road countries. It has trained over 200 specialists from 17 nations, including the United States, Russia, and Italy. But the cross-border internet hospital extends the value of Professor Xu Chang and his peers far beyond the operating theater. A general practitioner at a top-tier hospital in Xinjiang provides follow-up care for a patient in Kazakhstan through the platform. He says that when the patient stammered, "Thank you, doctor," in broken Chinese from the other side of the screen, he suddenly realized a doctor's value truly knows no borders. From healing one patient, to elevating an entire nation's medical standards, to warming the heart of a stranger behind a screen. This is the entirely new professional resonance that the cloud has brought to Chinese doctors. In truth, the significance of this runs far deeper than we might imagine. When we spoke of the Belt and Road in the past, we thought of railways, ports, and bridges hard infrastructure. Now, healthcare is evolving from hardware going global to capability going global. In 2025, Chinese medical equipment exports achieved leaps in both scale and quality. Surgical robot exports surged 368%, renal dialysis equipment by 33%. Yet the cross-border internet hospital represents something more advanced: standard export. The clinical experience of Chinese doctors, chronic disease management protocols, and rehabilitation training standards are being transmitted directly to partner nations through the cloud. An Egyptian vascular surgeon said something that struck me deeply after Professor Xu Chang performed the country's first in-situ fenestration surgery. He said, "We had planned for open surgery, but today, under Professor Xu's guidance, we applied innovative techniques that made the procedure feel effortless and fully within our control. Give a man a fish, and you feed him for a day. Teach him to fish, and you feed him for a lifetime. Equipment depreciates, but capabilities and standards endure." Finally, let me close with one sentence. That patient from Kazakhstan, after his recovery, wrote a handwritten letter to his Chinese doctor. He wrote, "I don't know how far Xinjiang is, but I know my doctor is only 15 minutes away. The finest medicine is not the most advanced equipment. It is a doctor who is always present when the patient needs them." The cross-border internet hospital has allowed presence to transcend geography. As 5G, AI, and multilingual translation make cloud consultations routine, patients along the Belt and Road will no longer be abandoned by medicine simply because of distance. The white coats of Chinese doctors are reaching farther and warming more lives one screen at a time. Medicine knows no borders. The cloud has a heartbeat. If you enjoyed this content, please follow us. Thank you for listening, and we'll see you in the next episode.